So what you can do, so you can put questions in the chat as we go along, and I can answer those, as well as sort of the PowerPoints, just to give us something to talk about. So we're in the process of marking assessment 2, which is going quite nicely. And there's a couple of things I'm just going to mention just to get students correct, making sure they got them correct for next time. Although I'd imagine the students that are listening are the students that didn't make that problem in the first place. So this one's we're 40% and it's 2,000 words. And again, just word count is word count, so not over and not a lot under. And this is really about a critical evaluation of patient deterioration. So we're providing the case study, so you have to choose one of the 3 case studies that we have provided. And the main thing is a critical evaluation. So make sure when you're writing it, you're not just summarizing what happened. So then the first part, introduction, discuss and justify, evaluate the case, and then recommendations and conclusions. So it is a extension of what you've done. So the first assessment item was to look at situational awareness and your poster. The second one was then to look at a case study and situational awareness. And now this is a case study we're provided where you're really looking at when things did go wrong. Although by reading some of your case studies from assessment 2, I can tell things have gone wrong in clinical without us having a coroner's case. So the main thing is that we're still getting slight mistakes from. Now, I know you're probably thinking, why does it matter what the title page and the formatting looks like? It does matter because we're teaching you to be registered nurses that can follow instructions. When you're writing charts, going in EMRs, writing for journals, doing a report or a chart audit, there's a format. And so this is just to teach you that you need to look, read the format and follow it. So title page, we're still getting title pages that aren't correct. So title of essay, course code, student name. I've got the title of essay twice. Essay report title and then word count. And then at the top of each page is page numbers at the upper right hand side and student number on the footer of each page. It's a fairly simple thing, but students are still getting it wrong. So make sure you know, and that's the reading and writing and referencing guide. So the introduction is worth 20 marks. So this is both introduction and then are you writing a little bit about what recognition and response to deterioration is, and how that influences, patient outcomes. So this is where you might add in things like what does the research say? What does the understanding of a pathway mean to patient outcomes? It'd be really great to see some nice stats in this area so that you may have, you can link this to your case study. So if you're in a pediatric, you might say that without following a pediatric assessment, then things go wrong. This is how likely they are, using the Australian Institute of Health and Welfare stats, or hospitals have stats. So you may even be able to find sort of some rural hospital stats where rural hospitals have more mistakes than metropolitan. And so this is where you want to present what tools and why you would use them. So if you've chosen the pediatric case, don't use tools for delirium. That I'm just looking up at a question from Brooke. The reading and writing cover sheet doesn't include the course code. Yeah, I know, but it is nice to include it so you don't get marked down, but it's because it's a generic one. The course code just means that you know which course you're doing as well. So in your recognition, also think then about the situational factors. So discuss the recognition response is 200 words. So sort of think about, if you're taking the older patient, should a delirium scale have been used? What does that look like? What sort of management and tools could be used for recognizing and responding to deterioration with research? And then the second half of this is looking at the situational factors. So this is again sort of thinking about, if, depending on which case study you've chosen, is it staffing factors about rural and remote? Is there lack of confidence? Is there staffing ratio issues or experience? Is there sort of like a fear of criticism which may have influenced? And see, these are where you're presenting them, but also linking them to the case study. And so as you're writing them, the evidence to say these make a difference and how much difference. So there's a fair bit of evidence that talks about allowing and encouraging nurses to have a voice in deterioration will actually improve patient outcomes. So if you're talking about that sort of nurses' experience, nurses' ability to voice concerns, you would probably use research like that. So just think about how you're going to present your argument to clearly and concisely evaluate situational factors in relation to sort of the case that you've chosen. So the more this all flows, the higher the marks. So if you talk about metropolitan, and then you talked about rural, and then your case study is sort of a metropolitan one, we might be wondering what was the point of having the difference there. And then the bulk of the marks is this 800 words, which is quite concise. So don't get stuck. What was it? The tunnel vision. Don't get stuck on one aspect and not go through the whole case. And remembering that we need to have enough depth to get marks, to give you marks, enough expansion and enough critique, but not so much on one topic that you've actually lost marks or not gained any further marks because you're doing the same point and you're elaborating too much detail on that point. So remembering 800 words is not a lot. So, if you sort of look at that even further and the aspects that you need to do, so 40 marks, then if you're sort of thinking that, for every little paragraph, it's going to be worth about 10 marks if you're going to sort of have 4 paragraphs. So 10 marks, you need to have 2 strongly justified points or several points which clearly are all linked together. So then you need to look at the actual condition. And so the coroner's cases are quite different conditions. So try and choose one that works with your clinical area. So you actually are learning more about your area. Your sort of that condition and management recommendations for this patient in the case study. So I'm thinking about what was the main concerns, what does that relate, and then that sort of looking at the case study and the situational factors. And so remember, they're coroner's cases, so they do step through quite a bit. So read over the coroner's case, outline the key points that you see, and then start moving from that on the situational factors. A lot of them are about failure to identify deterioration. A lot of them also about incorrect use of resources. So think about what that means as situational awareness, what it means in relation to this condition, because that then leads you to your last part, which is your recommendations. And so it's sort of got that, the condition, the critical evaluation of the case study with that situational factors, identify the patient-related complexities that contributed to the outcome, and the legal and ethical issues. So that's the 4 areas. So sort of try and think 40 marks, 4 areas, 10 marks an area. Don't get stuck on one area and don't have 2 lines about the legal and ethical conditions, but sort of think about how that works. And a lot of that is can be linked to the standards, but don't waste words on writing out the whole standard. We've had students do that, and it just clearly shows that they're sort of haven't really thought through what they're doing. And think outside the square. What other issues as registered nurses and working with other health professionals need to like look at that ethical illegal issues? So we, family engagement, health, understanding health literacy, looking at team dynamics and trustworthiness in the team. One of the case studies is about where the patient presented a couple of times and the staff didn't listen. So what does that bring in mind? Ryan's rule. Did the staff recognize and think about that? How did they document that? And so sort of as you're putting this together, really think about the points that we're looking for needs to be critically analysed and concise to get the word count and have 40 marks. And then the next bit is the recommendations. With slightly less marks at 30, but still a fair amount of words again. So you can balance. So you may decide I'll have slightly less words in the recommendations and put a little bit more words in the critical analysis, but that's up to you. We sort of just split these out so that you have enough words. But this is where you have to look at sort of the recommendations for improvement in relation to your trigger points. So don't get stuck with simple recommendations. Think about what you're saying were your situational concerns and your key patient concerns, and make sure you're developing recommendations which align with that. So you might want to, look at, where am I? Sort of the leadership. Was there a connection? You may want to look at sort of staffing, recognition, time for retrieval. Is there a problem there? Communication or missing documentation? Was pathways followed for sepsis properly? Was there a sort of a communication in relation to not recognizing and allowing the patient to and the family to speak? So that's all the different standards that we can look at. If it's an infection control one, was that an issue where that there wasn't full safeguards left for the patient? And so or was it in about training? So was there a lack of training, which meant the staff were not able to use the early warning system properly, or they weren't able to escalate and understand patient concerns properly? So as you're going through your outline to develop this essay, think about what you're going to use as your standards. Remember, it's not like using all of them, because they need to align with what you're actually saying in your recommendations and what you found in your situational awareness. And then again, support it with more than just so when we're talking about support your recommendations with research, we mean research, not the, Children's Hospital policies, and not just the national safety standards, but actual research. So thinking that this was a mixed method study which looked at evidence of repeating education in the teach back method to improve patients' understanding of home care. Or it might have been something where it was your rationale is about that simulation improves best practice for being able to follow a guideline. Does that make sense? And so we are looking at sort of how you've linked them all together and how they align with the case study that you've chosen. So I think the best thing is to really have a look at that case study, read it, underline the bits and work out what's important, then start thinking about what disease, so you get that condition organized, then the sort of patient issues, the situational awareness, and then your recommendations. And then conclude just a summary of your main area. So again, just thinking you might do a quick summary about your, regional and rural areas have a higher rate of transfer to metropolitan area, of which at times the timing is poorly done or something like that's very badly worded. But then using a early warning system and good communication strategies with the transport, the Royal Flying Doctors improves patient outcomes. So you're sort of summing up what you've said. And then sort of looking at that sort of priorities of your client group. So again, what did you say in part 1 and part 2? Finishing that off into your conclusion. And just on the note of referencing, so we're still getting mistakes in referencing, and I know we are a bit pedantic, but then so if you write a report, if you submit a journal article, if you go into any further study. So I've given you in the first two are the same reference. One's correct, one is not correct. And it's not a major problem, but it would lose you marks. So in the first one, I've just downloaded this straight from the website, but it has capitals on all the main words in the title. That is not actually APA. So you need to then physically change those. Make sure the cancer control, the journal name is in italics. If it's not published, so this one's just published, it will have a big number like that, which is just giving it a identification of it's only online. And then the DIO, make sure you've got it. It needs to be a live link, basically. Sometimes when you download them, and I couldn't get an example of this, I did search, it'll have two, it'll go https://dio.httpis//dio. It'll have it twice. So that's where you also need to pick up. So this is about you actually reading the references. Don't just copy and drop and expect them to be perfect. You do need to actually check them, because we're still getting students making minor errors in their referencing. And then when you've got websites, thinking about the retrieval date and the website, so that you need to have I will share these slides. So these two are so that's the Griffith, but then I like this website. I don't know if it's actually going to go. Oh, it does. I will just share screen over to here. I do like this website. So this is a APA style. No, it is just a general APA, but it's got everything. So it's got all your style guides, in-text, tables, references. Punctuation for international students is always a little bit tricky. And it sort of goes through the elements, the principles. It's got some nice, easy to understand information. So it gives you some nice examples, so you can then think, okay, well, what's my example look like? Journal article, and goes through. And so that is a nice website. So I will share the slide so you can then see what those links are. They are in the reading and writing and referencing guide, but so that you do need to, so if you click on this, which is in the course site, it has this link to this APA style, or you can just Google it, APA style, which is just a nice little way to just check your references. Right, so we're just going to go through and we'll see if we can get this a little bit interactive. So this is a different case study altogether about Marley, who's 4 years old. And it goes through her history, and then you've sort of got to look at what are the key aspects from the coroner's case. Now, the coroner's cases are fairly long, so do take the time to read them. I normally go through and highlight, and that's how, because we have, as academics and markers, we have an answer sheet. So we go through and highlight all the key aspects that we're hoping students will pick up. Now, we don't expect students to pick up everyone, but because you are, 40 marks, this is half of the assignment is about what you're picking up. Do make sure you have read it. And so look at what's wrong with the the child or the adult that's having a problem. And so that's that first part. Looking at the sort of situational factors. So in this one, I've said we've got, a whole range of risk factors because we've got the cultural, the child's age, locality, health literacy levels, condition, age-related risk. We've had some great pediatric assignments in A2, which have listed and provided evidence about the pediatric body as such a sort of very poor sort of compensator in some ways. It compensates for a long time and then it stops. So we've had some great evidence with that. So that's the sort of thing we're looking for. And so if you're looking at the older adult, you might then talk about the older adult, the whole risk factors and comorbidities, how that links together. And remember, using stats really shows, one, you've understood what the research you're reading enough to then put those stats in so they make sense. And of course, with any of the ones which have got transfer, which a lot of them actually do, I think that's what we've wanted to get, because it's all about the transfer. Transfer risk, staffing numbers, staff experiencing equipment are all just key aspects of situational factors. Now, from some of the A2, it looked like some of the students hadn't actually read the whole module we have on situational factors. So think about sort of just going into that module, refreshing your memory about, the different aspects, organizational, patient, and staffing sort of aspects of situational problems. And the other thing that was done half in A2 was actually naming a deterioration tool. And so one of the things we do want you to do, particularly in this one, is really look at what tool to use, how to use it, how it helps, how it's linked to this particular patient cohort, and sort of what that does when you're looking at the effectiveness. But then there's factors to using any sorts of early warning sort of charting, because it does rely on the person using it. I did find some research which looked at the Glasgow Coma Scale, and they tested on the same patient at the same time. Numerous staff came and did OBS, and they were all different. And I think this is really our point for training. The problem with a lot of our training of student nurses, undergraduates, is they're done on mannequins, which are very stable and don't have much change. And then they have real patients who are very unstable and have a lot of change and a lot of difference, which means then when you're looking at staffing and understanding how to identify, skin colors, capillary refill, like it's not as easy as it is when you're actually standing there looking at that. Respiratory effort, So I think sort of looking at some of the research about the effectiveness of using these high level sort of early warning protocols and frameworks does relate a lot to the staffing. And I might just stop there because I think that's actually a good opportunity. We've got 11 students. So in just looking at what I've talked about, what are some things that you can just go, oh yeah, I definitely can see that the situational aspects of staffing or the clinical environment that influence patient outcomes, or the use of, whose ward area is using the early warning tools? Does everyone know how to use them effectively? That'll just give me a chance to have a mouthful of my coffee. Does anyone want to share? Or so you're saying, Megan, you're not using them in critical care because you're always doing vital signs. But are you also then, I think sometimes in critical care, we get this sort of tunnel vision of vital signs and actually forget sometimes those other softer patient signs. Would you agree with that? Sometimes people fail to recognize changes in, peripheral circulation and things like that, or changes in a sort of mood status as a patient might head into some sort of delirium. You might work in a really high area with well-trained staff, but often, we get so focused on the basic vital signs, monitoring the sort of any actual physical recordings that we've got, assessments attached to the patient, all the actual medications, that sometimes we do forget to really look at the softer patient factors. Did anyone else want to share? I can't imagine the clinical environment's changed that much since when I worked in ICU. So that becomes, as soon as there is any assessment, the full assessments, and then you go straight to an early warning one, assessment for deterioration, which is good. You're obviously working in a high level crit care. Did anyone else want to sort of share their experience of using some of the early warning systems, or the pediatric one, or the delirium scale? It's silence, except for Megan. So CAM ICU, is that, I don't know any of the acronyms as well. I shall move on. We've only got one, only got Megan. So Anala is, yeah, saying that the fall fairly head to toe. Um, and it really, there's a lot to be said for staff ratios. Um, yeah, and see, it's a tricky, normally the early warning systems work on the ward to get the patient into a crit care area. But then I think more in the crit care area, it's looking at some of the softer signs, which in an adult patient are sort of your delirium pickups and your peripheral shutdowns and things like that, which often sort of, it's sometimes trickier to pick those up because you're so focused on a lot of other things. but I shall go to the next slide. Um, so I think one of the things as you're working through your case study, thinking about, I was going to thinking that it had to be a confusion assessment, but I wasn't sure. So thinking your factors related to deterioration, um, so looking at just the simple ones, risk of, age, diagnosis, comorbidities, all of those go in that first part. And then your complexity, also another situational factor. So your parental understanding or your family understanding, health literacy levels, just general location. So even if you were in, Redland Bay Hospital as opposed to Princess Alexandra, big difference in staff support, experience, patient ratios should be the same, but there may be differences in the experience of the staff in those ratios. So, there's a lot of evidence sort of talking about that. So that's how you back up your critical analysis of these case studies that we've got for you to look at. Then your legal and ethical issues, thinking about best practice, so of staffing, best care of children, how yet the type of documentation that was used, timely, not timely, clear, it followed a planned method, or was it just notes written, all adds in and see. All of that's got references to support best practice. Also, that sort of whole aspect of duty of care, neglect, and sort of our own, we need to be confident to manage the level of patients that we have. If not, are we sort of then failing our own legal and ethical boundaries? Delays in care as well, which can be a resource aspect. So again, you can link if there was a delay in care because of resources, then that becomes still a sort of an ethical issue on the staffing, but also a legal issue about maybe the bigger picture of why wasn't there enough resources to support regional and rural areas. And then, your failure with communication or recognizing and responding or infection control, depending on the different case studies that you've chosen. So it's there's a lot in this assignment. And I think the first thing is to really start looking at the case studies. Oh, I was going to find one, but I don't have it. And think about sort of, what they first, the trajectory of care. So when they first sought help, how long between understanding or recognizing problem in the patient or child to when they sought help, because that's about health literacy. And then recognition of the health professional and how long that sort of more help was sort of organized. Also then the complexity of the presenting patient, comorbidities, all of those aspects. The shift time, a lot of this A2s often, if that patient's coming through emergency, a lot of the factors that were situational were the time of presentation, whether it was when it was really busy or at, in a shift changeover or at night shift where there's just different staffing issues. And so there are things to think about when you're reading through the coroner's cases. At what time? I think one of them was over a weekend. And, we know there's just less people, but is that actually then negligent of the hospital to not have appropriate staffing? So this is your critical analysis, because you can always say, oh, that always happens, but that's you summarizing it. The critical analysis is saying, no, the hospital did not meet their legal rights to these patients to have enough staff on. I think I've probably talked enough. Any questions? Was that helpful to just go through it a bit? one of the students has mentioned that I didn't put the exemplar up. I do apologize for that. I sort of got this course a week before it was to run. I was meant to be teaching the advanced practice course, and then we had to change. And so I've been a bit on the back foot since then, in making sure I've got the right information. So I'm sorry I haven't put the exemplar up. I will get it up in the next few days. Um, Opportunity for questions. And the other thing is I am very slack on that discussion board. If you email me, I'll answer your questions straight away, but I do keep forgetting to have a look at the courses discussion board. So hopefully the case studies that we've got are interesting for you. So we've got child and then 2 adults. I think one, James is 87. I think the other person is O'Donnell. We did try and make them different. What always worries me is when you're actually reading the hospitals these were in. I think Simon O'Donnell is the younger person with cerebral palsy. Has everyone chosen their case study? I'm just trying to find the age of the last one. I'm sure I made them 3 different ages. So we had an older adult, a child, and then a middle-aged person. Everyone's managed to find a case study that they can link with. For those that are working in rural areas, you might choose one of the rural ones. For those that are in the pediatrics, they can sort of go through the pediatric one. So yeah, they're always a little bit worrying and hopefully make you reflect on how easy it is to make a mistake that could go awfully wrong. Hopefully none of you have made massive mistakes in your life, but it's a tricky thing working as a health professional because of the fact that we work in really complex and changing environments with different staff every day, different levels, and so many decisions and information that we have to sift through. So um, yes, things can go wrong, and sometimes they do, but hopefully as you become a little bit more aware of those factors around it, you yourselves will become a bit more situationally aware and have no incidents. Yeah, so definitely, I think it's always best to pick something that's useful for your clinical area. So yeah, that's why we tend to have the 3 different ones, so that choose one that suits your area, because then you could actually, from your information, present it back to your ward as an in-service about when things go wrong, what are the factors. The aim is to sort of build your understanding, and also build your skills as a health professional. So we've had those A2. I think this is coming up the 2nd week. I've lost track a bit. Were they admitted? They were submitted last week or the week before? They came in last week, so we've had them a week and a bit. Half of them are marked, so we are getting through them quite nicely. And so the aim would be to have them finish by next week, because then your next assignment is due in week 12. So then you'll have them for a week. And I've covered 2 of the factors which are just where students are losing marks for easy things: references and title page, which, yeah. And just being aware of that critical analysis. Once you've written your notes, then start to think critically about what you need to write, because sometimes students have just got sort of a whole paragraph about one factor, but they've just repeated the same information. They haven't actually expanded or got depth in that information. So just thinking about these words that, when you're looking at this one, where 40 marks and it's got 4 sections, think about the fact that you're going to need to sort of divide up your writing or your points. So you've got 4 clear sections that you're presenting information that goes across to give you the 40 marks. So when you're looking at the criteria, it is about the marking criteria. So to get a HT, clearly and concisely evaluates situational factors for related to patient's deterioration in the chosen case. Includes strong justification for evaluation of case study with references, best practice guidelines, and a wide range of scholarly literature. So this is sort of the marking criteria, is that you've done the 4 parts above. Oh, I've got the yawns up. I need my coffee. Any other questions or comments? I will get that exemplar up. The other thing, of course, at this time of trimester, eventually your student evaluations will come out. So just thinking that, remembering any comments about the course and information are always useful. Try and be positive. Hopefully you've enjoyed the course and found that the assessment items and the modules have actually been tailored to building your understanding. Well, without much more information or questions, I think we can call it a day. Hopefully you guys aren't dashing back in to have a quick mouthful to eat and then back to work. And then those that are listening in can have a look through, and I will put up the recording. I'll make it open access again and link the PowerPoint to it so you can see. Okay, thank you very much for linking in, and look forward to the end of trimester.